Um, I'm going to confess, and this will be recorded, that I'm not a morning person. So hopefully this will go well. I am also a social worker by trade, but I am the community health worker program lead through the Ohio Alliance for Population Health through Ohio University. And I've been involved in this project since we've received funding from MedTap in, I believe, 2017 or 2018. So today I'm going to share a case study about destiny with you, and we are going to watch a few modules interspersed with content and discussion. And I wanted to make sure the first module that I'll share will be a traditional video, so we'll all watch it together. After that, we have QR codes, and I just wanted to make sure that everybody has a phone with them where they can use the QR code. If not, you can also use the link, but just wanted to make sure that we were all that would be the format that we would use. It makes the experience a little more customized and rich. So as John said, this is using virtual reality to visualize the opioid crisis. Oops. This project was originally funded by the Ohio Department of Medicaid and administered by the Ohio College of Medicine Government Resource Center. And so the views expressed in this are solely those of the creators and don't represent the views of the state of Ohio or federal Medicaid programs. You all are, I'm sure, experts on this content, but we know that opioid use disorder is defined as a pattern of opioid use that leads to clinical impairment, and that fatalities were the leading, overdose fatalities for the leading cause of death among Americans under 50 from 2000 to 2020. And then we saw a spike between 2020 and 2021, which was during the pandemic, and then that healthcare professionals are key points of contact for people with OUD. We also know that there is stigma attached to using opioids, and that clinicians sometimes hold a lower regard, less motivation, and feelings of dissatisfaction when working with people with OUD. And this was kind of the impetus for us focusing on this topic when we developed the content. So the stigma from primary care providers decreases their likelihood of prescribing FDA-approved medications. And then interventions designed to reduce stigma and increase empathy are needed. So that is why we're here today. We are going to confront our biases, raise awareness of our biases, call attention to social determinants of health that have that compounding effect on people's treatment, and then delineate the relationship to opioid use disorder. So this is Destiny, and Destiny is a 23-year-old pregnant woman from Appalachia. She is attempting to overcome her struggle with addiction to opioids, found out that she's pregnant. So this was an unplanned pregnancy, and she was using at the time of pregnancy, of becoming pregnant. This project was developed with the input of over 100 faculty members, community professionals, people with lived experience. So it's a pretty robust, it was a robust project to take on. We developed 2 of these VR simulations at the same time, Destiny and Lula May. And Lula May is about diabetes, a woman with diabetes. And so this case study obviously focuses on Destiny, and the full project has 12 videos. We're going to see a sample of those videos today. And if we were all in the same room, we would use oculars for this project. We will still have some VR exposure though. So let's meet Destiny. I will say that there are some intense scenes. So if at any point you need to step out, push pause, stop the video, you're more than welcome to. But Destiny has a history of trauma, and we revisit some of that trauma through these videos. And there might be some bad words, so you can hold your 9-month-old's little ears. But you should be able to scan this QR code or click on the YouTube link. Actually, I'm sorry, I lied. This is our first video, so this is a standard video, and we're going to watch it all together. Hopefully. John, I can see you. So if the sound works, will you give me a thumbs up?
Will do.
Where the fuck did you put it? You were the last one to fucking have it. Where the hell is it? You had it last night after pizza, so where's it now? Huh? Where the hell is it? Hello? Are you listening? Did you shoot the jump?
No, I have a doctor's opinion.
Where the hell is it?
Have it.
I was looking for this for 20 fucking minutes.
I missed the butt.
Then what?
I know there's a lot of questions, but it's important you let us know everything so we can make sure you have a healthy baby.
Yes, ma'am. That's what I want.
Well, at this stage in your pregnancy, we should have already seen you. But it's good you're here. Let's check your vitals, starting with your blood pressure. What's up with the marks? Please be honest with me.
Well, if you write anything about these, they'll take my baby away.
Not necessarily. It's not about you anymore. we at least talk about the bruises? Are you safe where you live?
Sure,
What about when the baby comes?
it'll be even safer then.
I think you need to speak to a social worker. You can get help.
Yeah, sure.
Well, your blood pressure is good. You put down that you smoke?
I'm quitting. I know it's not good for the baby.
Or you? I'm concerned about your weight. It's low for your height, but the doctor will talk to you about that.
I haven't really been hungry.
What?
I haven't really been hungry.
You need to eat regularly when you're pregnant. You have food stamps, right?
It's not a big deal.
Do you take any vitamins?
Uh,
Folic acid, that's the important one. I'm sure a social worker can help you get access to more food.
don't social workers report everything to the police?
Not unless, look, they can get you help.
Now I'm just gonna put this one on the front. I want you to tuck that one in as well.
This won't take long.
Hi, Destiny. I'm Dr. Bell. It's a girl.
It's a girl?
You're happy.
I am.
So she's smaller than she should be at this gestational age.
Is that bad?
Women with untreated substance use disorder can have a miscarriage or a placental abruption, really low birth weight. If you keep using drugs, you're putting your baby at risk.
Right. So let's talk about what we saw there. What were the social determinants of health or social drivers of health that you all picked up on?
It looks like it was an impoverished setting that and somewhat, well, beyond somewhat, a lot of dirt, a lot of things unkempt. But truthfully, I keep going back to the interaction with the nurse.
Mhm, mhm. And we'll talk about that in a minute, John.
Healthcare access and quality. It seems like she hadn't had regular prenatal care.
Yes, it's pretty safe to assume this was her first prenatal visit. So, and she, she's pretty far along with the pregnancy. So
She had sorry.
go ahead.
I'm sorry. She had lack of transportation, so she had to walk.
Good. Lack of transportation. What did it seem like her transportation options were?
Seemed like her partner or just walking. So I don't even know, did she have insurance? That, something like just putting this out there, but Medicaid, that she could do a ride share or something like that in the future for appointments.
Good. Yeah.
Yeah, and I'm from the belief that zip code is a social determinant of health. In a lot of rural areas, there's simply not as many Ubers. There's not any public transportation. So transportation is a real barrier.
It sure is. And John, in rural areas, that it's always the social determinant of health or the issue that comes, it just rises to the top in any conversation we have as a barrier. Yeah, Stacy, you're saying bus, but in a rural area, a bus is probably not an option. Um,
No, I just meant in the video. She mentioned she
she
had missed
missed.
the bus. Yes,
Mhm.
sorry.
Yeah, yeah, good. So yeah, poverty, living conditions are less than ideal. Um, anything else? Oh, go ahead.
And it also her fear of social workers.
Mm-hmm.
You can't have that fear. And I see that in practice as well. The fear of providers, the fear. That fear is real.
Yes.
And
Yeah.
and that's one of the things that we just have to do better is to just try to pull the fear down and just go, it's okay. It's okay. I'm gonna help you. If she just, because soon as that, just like John said, soon as she's the nurse seen those marks,
Mm-hmm.
her nonverbals were, yeah. And we've all seen that. I've seen it when I've went to the hospital before, maybe not in that particular scenario, but I read people's nonverbals and I'm like, you're interesting.
Right. Right. So there's this existing mistrust. And then after that, it was like a switch flipped for
Kerri,
them.
she had a phone, but it wasn't clear whether she would have had internet at home or a way to do a virtual visit or to get to information that would be helpful.
I think you are the first person to mention that. That's a great point. Yeah, we don't know what her internet access is, or even um, kind of digital literacy as far as using the internet. Good. Or having a telehealth option.
I was going to say, and I don't know where this fits into social determinants of health, but interpersonal violence or domestic violence. She had a super unsupportive partner that's, kind of swearing at her, seems oblivious to the fact that she's pregnant, doesn't go with her to the appointment, nothing. I mean, it's just, she may as well have been a lump on a log. He didn't really care. I mean, he's using
She
as
had to
well.
wait for him to pass out before she dared to leave the house.
Yep.
Yes.
Yep.
Mm-hmm.
And having a co-user in the house makes recovery and treatment really complicated.
It sure does. Mm-hmm. Yes. And I think we'll see more of how complicated that can be, John. Mm-hmm. Thank you. So I'm going to, in the interest of time, I'm going to move forward here. So we kind of already talked about the transportation options, that they are pretty limited and that can get in the way of her access to health. This next video you are going to watch using either the QR code or the link. Does that work for everyone? I saw some conversation in the chat. Okay, so we can go ahead and get started with this video then. And then when you finish, you can just come back on and you can either tell me in the chat that you're ready or give me a thumbs up on the video.
And don't forget to move your video around because this shows, I think, a 360 view, if I'm not wrong.
Yes, you're right. Thank you so much. You can grab the screen and move around. So please look around in all directions, up and down, to the left and to the right, and pay attention to what you see. Thank you, Kay.
I'm done. We might want to start checking in on folks.
It looks like most people are finished.
I'm done.
Great. Thank you. Okay, so Kay, you had a strong reaction to the mother. What did we learn there as far as what Destiny's support system looks like from her family of origin and other social determinants of health that might be affecting how she's interacting with healthcare or accessing healthcare?
Well, now she's unstably housed or about to be homeless. So that's a big problem.
I mean, there's probably some, to me, you get the impression there's probably something else there with the live-in boyfriend and probably some, we always talk about it. There's always some trauma somewhere.
Yes, thank you. And we know that adverse childhood experiences have a direct connection to substance use disorder later on in life. And so, yeah, there is something happening there. And we learn a little bit more about that later on.
It explains maybe a little bit about the aversion to child protective services and social workers and things like that. Because just like there's a dearth of foster parents and foster families in rural areas. So sometimes the people that might not have been acceptable in more robust environments are go-to foster homes in rural environments.
Very
So
good.
it's not uncommon for some bad experiences to happen with kids.
Yeah. I like to also talk about how easy it is sometimes for people who've had a pretty positive upbringing and supportive family environment to just say, just leave the boyfriend or just stop having this relationship with mom because it's toxic. But it's really not that simple when you have a limited support system. Tiffany, I see you shaking your head um, because she is getting something from these relationships, even though it's not all positive. What is she getting from mom? What did we see her get in this interaction? Right, my dog is, it's morning walking time.
I mean, at the bear, she got some food.
Right. She got some food. What did you notice about the food?
Frozen food. It wasn't even like a fresh meal.
Right.
Yeah, pretty
And I
starchy,
think,
pretty white meal. Mm-hmm.
and I think too, hope, just a little bit of hope that just maybe, I could get out from the boyfriend. Maybe this could be my way to a safer environment for my baby.
Good. Yeah, the relationship isn't totally fractured. There is some connection there, isn't there? You can see that mom has some conflicting feelings, but recognizes that, yeah, it's just not an option for Destiny to stay there. So
Looked
yeah.
like mom's place was a little nicer too, and that she had acquired some more, that she had kind of gotten ahead a little bit through her work or through being with her unsatisfactory partner. And I wondered if mom knew about the drug use. It didn't come up, but she just handed over some money without any strings attached, or if that's just something that's understood but not talked about.
Yeah, good points. And some of these things we leave really open for interpretation and discussion. So we don't really know if mom's aware of the drug use. Yeah, so there is a level of support, but also mom is choosing boyfriend over Destiny, and this isn't the first time that she's done that. So that doesn't feel good for Destiny to not have that unconditional support of her from her mom. Just share the screen again. So we know that ACEs or adverse childhood experiences increase the risk of OUD and overdose later in life, and that the odds of opioid misuse increases as the number of ACEs increase. And then that individuals experiencing 5 or more ACEs were 15 times more likely to report opioid misuse than those experiencing no ACEs. We touched on most of these other social determinants of health that affect Destiny's health, including housing insecurity. So these are some questions that you can ask that open up that conversation about housing. All right, so this is our next simulation, and I will be sure and drop this link into the chat. Into the chat. But you can go ahead and start the video.
Kerri, can you put the QR code back up for a second?
Mhm. Yes, 1 second. Sorry about this. I'm not quite as smooth at this as Matt is. We usually tag team it and he does all the tech part. There you go. Okay. So now unemployment has become another social determinant. Yeah. Um, I this the domino effect, I think, of uh using substances in a rural community, and then losing your job, I feel like it can just, this can just have a major impact on her and her health, obviously. So what all came up for you as you watched this?
The stigma of substance use disorder, the judgment
Hmm.
that she's
Yeah.
facing.
Did he have any real evidence that she's the one who stole the money?
Doesn't seem like it.
Doesn't seem like it. No. And so she's starting out in a not so glamorous job to begin with in a small community, where word is probably going to get out pretty quickly that she lost her job because she was stealing money, and she's, a drug addict, and therefore the likelihood of finding another job on top of being pregnant is probably pretty limited. Anything else come up for you? Did you all look down at your bellies?
Yeah, where was her belly? I'm like, did she have the baby? That was the first thing came to my mind. Am I tripping? I was like, where's her belly? She's still pregnant?
It wasn't as big as in this one. I wonder if they moved the series around a little bit. Any other factors when you looked, like when you looked around that hotel room, did you notice anything? Sometimes people see that there's blood on a towel, and we talk about the chemicals that she's exposed to cleaning. So just the environmental factors of doing this kind of work, especially when she's pregnant. All right, so let's move forward and go into the next. So I'm just going to say, at this point, you can see Destiny just doesn't have anyone in her corner, right? We would normally watch 12 videos. You'd see 6 videos that involve the nurse and 6 that involve the social worker. We don't have the luxury to do that this morning, but you would get kind of a fuller picture of how little support she actually does have if we were able to watch all of the videos.
Kerri, she does say she's in a program, and it seems like there should be someone in the program that could advocate for her, or at least confirm that she's in a program. But you wonder about, what is the program? What's the quality of it? You know, what's available out there where she is, and is it actually helping her, or is someone, you know, getting Medicaid money and not really providing effective care?
Yes, yes. We don't get a good feel for what the program looks like. And the section on the social worker does give us a little bit more information about that, and about just how motivated she is to be trying to change, because we know that being pregnant can be a motivator, a very strong motivator. And so as healthcare professionals, how do we optimize this time, so that we can get her to the best place possible?
Gary, can I ask a strange question? This would probably be ignorance and insensitivity. I feel blessed that I have social workers and case workers and all those things to try to help, and it never quite reached there. But if I watch these videos and I was like a primary care who never did this before, I go, oh, thank God I don't do this. Because this is all the stuff, I hate to say it, a lot of people want to put their hands in it's the same reason why people say, oh, you deal with addicts. I'm like, they're nice people. They just need,
Right. Well, and thank you for bringing that up. I mean, that's the reason that we've created this series, is to really try to humanize the issues that folks are going through and to kind of flesh out the picture.
I just think the hard part is, I mean, it's the humanization, and for most of us who do this with legitimate, we I feel like I'm at work right now. But the hard part is for people who don't do this stuff. They go, I don't have the resources to help this. Like, it's me putting a Band-Aid on the situation, and that thing needs to go to surgery.
Yes, and I would push back a little bit and say that treating people like humans is the first step. And that's the part that sometimes, I mean, we can just really
Well, and I guess maybe my question is, to your point, is that part of maybe we haven't got there and I'm putting the cart before the horse. Like, is that like the final part? Because getting people, problem is this could be very frightening.
Yes.
If you're telling me there's 12 videos, I'd be stopping at 2 or 3.
Yeah. Thank you.
You know what I mean? And it's like, I'm not reading the last chapter in the book first. I don't want to know how the story ends.
It does turn around, I promise. And we provide some opportunities for the providers to do things differently. What we didn't talk a whole lot about was just how Nurse Kate wasn't supportive and how Destiny responded to that. But had that interaction been different, Nurse Kate and Destiny could have had an alliance from the beginning, right? And we also talk about how when we treat people, when we are skilled in the way that we communicate with folks, it's also self-care for us, right? Because we know that we're doing the best we can. And so, yeah, let's try and at least get through 2 more videos, because I think that they're critical to understanding the way that this flows. Does this, oh, no, Pedro, this YouTube video is the next in the series, but I'll give you all the link to the whole website where we have all the videos, okay, at the
Can
end.
I add one more thing?
Yes, absolutely.
For me, what I noticed about the nurse is, that was like the first interaction she had. So it just really colors her forward interactions with healthcare providers, right?
Mhm.
I'm not going to be trusting anyone else if that was the first thing that the first interaction I had with people.
Right. And it reinforces my mistrust of authority or of people in those positions.
And Kerri, just 15 seconds. I definitely agree with what everybody said. I just want to piggyback off of Dr. Goldman. Dr. Delis Reyes did a fantastic presentation on how we should treat people with addiction the same way we treat diabetes, the same way we treat cancer. It was a fabulous presentation that she's done a couple times. And she talks about if you just treat them like they have diabetes and cancer, everything would be fine. But because providers, because of the stigma, that's why we're here today. So I agree with everyone.
Thank you so much for saying that. Yeah, that's really helpful. Okay, let's jump into this one. This is one of my favorite videos. So let's check this out.
Kerri, you're muted.
Whew, y'all, you should do echo at 4 in the afternoon. I tell ya, 7 a.m. is brutal. um, yeah. So, John, I'm sorry I traumatized you. It's a hard one. And we learn a lot about Destiny in this scenario. She was in foster care, didn't have support of her grandmother like her other the other kids in the family did. What else did you all pick up on?
I just had a very slight suspicion. It wasn't so slight. When we see the scene where dad comes into the doorway and says, Mom's working late, it's just you and me, I was a little worried about what came after that. Don't make me explain.
Well, we once again leave a lot of things open for interpretation, but I think it's safe to say that there was sexual abuse in Destiny's childhood.
And I hate to be the time clock police, but we only have about 8 minutes left.
All right. Let's watch
Something that will be uplifting before we go into the long weekend.
All right. This is our last video in this half of the scenarios. Oops, sorry about that. Can't click and share it. Give me 1 second. I have to yeah. All right. Here is your link. Okay. I think most of you are done. So this last video we use to practice a different communication style with healthcare providers so that they can see how important the way that we communicate with our patients and clients it can really shift. I think with that first video, it's easy to imagine that Destiny would not return to prenatal care, or that she might have some pretty negative feelings about coming back because of the lack of support that she felt from Nurse Kate. This interaction was very different. What did you all notice? Oh, 1 minute.
Well, it took place in a safe environment.
But a very institutional one. It looked like an emergency department or a labor deck or something. I also didn't really hear much. Well, I didn't hear much from the provider, but I didn't see much true motivational interviewing going on.
Yeah, there's more in the next kind of 6 series with the social worker, but using we language, positive support, just really being present with Destiny. Yeah, Kate, I was going to share that as well. I'm going to just move through these real quick. Kate kind of had, I think, the fortune to see all of our the full series. But I wanted to share just a little bit of data. These are word clouds that we did with providers that we asked them to write down 3 words before watching the 12 videos and then 3 words after. And so I think this is really powerful. These are the words, this is the preview. These are the words that came up initially. And then this is what we saw after watching the full series. So we saw a lot of more strength-based words, a lot of more positivity and hope. So I know that this was a really, you guys caught a whole lot of the more negative stuff and less of the positive videos. But really understanding a client's situation and connecting with them, it can really build the alliance and affect our bias in working with our clients. So, oops.
Yeah, Kerri, we're up against it, and I'm wondering because there's a lot of applicability to this particular instrument, both in education settings, CEU settings, workshops, all kinds of things. Is this proprietary, or is there a link where we can use this?
Yeah, here's the link, John, at the bottom of this oops, you're not seeing it. Sorry. Here we go. At the bottom of this slide is the link. It's not proprietary. This is all funded by Medicaid, available for public use. We can facilitate, it's really powerful with oculars. So, we can facilitate in person. We've facilitated thousands of these to thousands of healthcare professionals and community members around the state of Ohio. Like I said, doing the full series is really powerful because you really get the kind of a fuller picture of Destiny's situation. We also have some shorter offerings that are related to other healthcare issues, working with different healthcare professionals, so pharmacists, physicians. So tried to use a similar model, but applying it to different healthcare issues and different healthcare professionals.
Well, I would love to thank you for this. I know we will make the PowerPoint and these links available to participants. It already looks like Dr. Block is going to disseminate this down there in Franklin County on some levels. This was really interesting stuff. I wish we had more time for some dialogue because I know there's a lot of questions and comments and insights people would like to bring forward. Yes. Kerri, thank you for doing this. And just a reminder for everybody, our EADS code for today is